Good morning, everyone, to all the media who are here today and to all you folks who are at home. This is a briefing for the Reentry Task Force of the Incident Command System program that has been initiated here at the University of Arizona. I'm Nancy Montoya. I am the newly appointed Public Information Officer for anyone of the media. If you need help, if you need us to help accommodate you, please give me a call. Let me introduce you to the panelists today. We have a ton of brain power on this stage here. Some of the smartest people I've ever met. Right here, number one, is Dr. Richard Carmona. Dr. Carmona was the 17th Surgeon General of the United States and is a distinguished professor of public health at Mel and Enid Zuckerman College of Public Health. Welcome, Dr. Carmona. Next to him is our provost. Dr. Liesl is the senior vice president and the provost of the University of Arizona. And next to Dr. Folks is Dr. Cecilia Rosales. Nice to see you, Cecilia. She's the associate dean of the Phoenix campus. She's also professor and chair of the Division of Public Health Practice and Transitional Research. And next to Dr. Rosales is Kacey Ernst. Hello, Kacey. Thank you for joining us today. She is the associate professor and program director of epidemiology and biostatistics department. Next to Dr. Ernst is Joyce Schroeder, who is the department head of the Molecular and Cellular Biology Department at the College of Science at the University of Arizona. Thank you for joining us.
They've switched, Nancy.
Oh, you guys switched on me, huh? Okay, well, we'll get that right eventually. So Kate is there, right?
Yes.
All right, Kate. Oh, it's live, folks. You know how that goes. And finally, at the very end, is our own Dr. Robert Robbins. Dr. Robbins is the president of the University of Arizona and is staying on top of everything that's happening here in terms of how are we going to reopen the University of Arizona. Actually, we've never been closed. But how do we re-enter students and do it with the lowest risk possible? Dr. Robbins, the floor is yours.
Nancy, thank you for joining the team. You and Dr. Carmona have been here at the university for a long time, and you're so connected to everything that's going on here, and it's just a blessing for us to have you at the university and for you to take on this important role. I'm not going to say much today because there's so many people who have so much to say, but we will be coming every week to update our local community, university community, Southern Arizona community about what we're doing in terms of evaluating a very rigorous, meticulous, careful idea of bringing people back to campus. That's not decided yet. It's our intention. I've announced our intention to bring students back in the fall. Liesl, how many days is it now?
89 days today.
89 days today. Okay, so there's a lot of work to do. Liesl has been incredible at leading a task force that all of these individuals have been part of, and we are so fortunate to have Dr. Carmona join the team and bring the structure of incident command into the university to help us be organized and disciplined to operationalize the policies that we're going to come up with. We do not have all of those policies. I want to emphasize we don't have all the answers right now. Liesl and I are talking to our colleagues across the country and around the world and trying to understand what others are going through. And every campus has their own distinctive set of challenges and headwinds. So we will be very purposeful, very thoughtful, and as I said, meticulous as we work for the next 89 days. My hope is for the next 60 days, we can get to a final answer of a go, no go about re-entering the campus and bringing people back. Obviously, we want to do that to provide the maximum protection for everyone that will be on campus. And Liesl will comment more, I think, about how she envisions the classroom and the faculty and the options we'll have for people. But I want to make it clear, we will not set sail on this journey unless we think it's as safe as we can possibly make it. And I'll emphasize this every time, we cannot make this risk-free. So we want to do everything we can to try to mitigate all the risks that we will inevitably face. So now I think I turn it back to Nancy, or just directly to Dr.
We'll
Carmona?
go directly to Dr. Carmona.
Thank you. Thank you, Mr. President. I know I speak for our team. We really appreciate your leadership in putting together a great task force and the incident command system to be able to do the necessary due diligence, to be able to provide you the information necessary to make an informed decision as to how, when, and if the university will open. And as you've emphasized to us repeatedly, unless it's safe, unless it is something that we've been able to mitigate the risk as much as possible, we'll have to, not open the university if that's the case. So I think your point is, and I would like to reinforce it as well because I speak about it with our team on a regular basis, we're moving ahead with the plan and the mission that you've given us to open the university and have it stood up. But moving along with that plan to get the infrastructure ready to go when and if students arrive is all the epidemiologic data, all of the scientific data that the task force here has provided us so that we can put that together in such a way that we can make an informed decision and allow you then to make the final decision. But I think it's a very insightful way of doing this. As you know, many colleges, universities are struggling with this now, making decisions just empirically to open or not open because of the fear, the uncertainty. But I think this is truly an academic approach to be able to take the thought leaders in our university, challenge them to come up with the best practices, aggregate that data, bring it forward so that the incident management team can sort through it and then come up with a plan based on all of the intellect and input that the experts have given us to ensure that we mitigate risk and are optimally prepared to open our university when you make the decision. So thank you for the opportunity, and I'll pass it over now to our Provost, Dr. Folks.
Thank you, Dr. Carmona. It's definitely a set of challenges we've got in front of us, but one of the points that I'd like to make clear to everybody is that the risk of developing serious complications from COVID-19 is incredibly low among, let's say, the 20 to 29-year-old age demographic. And in fact, we're blessed here in Tucson as well in that our population's median age is 33.3 years, which also is wonderful in terms of the risks that we see from COVID-19 in our community. So we've got things working in our favor in that regard. Our student population tends to skew very young, Tucson skews very young, and those are the people for whom COVID-19 poses low risks. Now, what that tells us, though, is that one of our core challenges is making sure that our faculty and staff who may be in higher risk categories are able to protect themselves really effectively. So we're working through that process now to work out how can we provide maximum flexibility in the ways we deliver instruction on our campuses, both here in Tucson, at our branch campus in Sierra Vista, and across our distance campus network, so that people can continue to move forward with their educational goals while being able to make decisions that keep themselves as well protected as possible. And so some of the things that we're working on will be to reconfigure our dormitories so there's lower occupancy in the dormitories. We're working to provide maximum flexibility in how we deliver instruction so that students that are very comfortable coming into face-to-face instruction are able to do that and can get a full campus experience and a full, rich, engaged learning classroom experience. But if they need to step out of that for any reason, either because they're in a high-risk category or because they might have come into contact with somebody who's tested positive and so they need to quarantine for 14 days, then we'll provide for them an opportunity to continue learning through remote and online means. They'll still be able to engage with their class, they'll still be able to engage with their faculty members, but they'll be able to do that from their homes. So maximum flexibility is what we're looking for everybody for the fall semester, and we're going to need to be nimble. We're going to anticipate that students and potentially our faculty and our staff may be moving in and out of face-to-face engagement as circumstances require it. So that's where we're headed in terms of what's going on in the classrooms. I want to add one more piece because it's something that's certainly topical. We do anticipate requiring that people wear masks at all times when they're indoors, except if they're in their own office space or in a well-separated workspace of their own. We do think this is going to be needed in order to minimize the risk of spread of disease in indoor spaces. The data is showing unambiguously that indoor spaces pose much higher risks for spread of disease than outdoor spaces, and we think the use of masks indoors will be a key piece to making sure that we minimize the spread of disease. Those soft face coverings are the minimum requirement. We think they're reasonably comfortable for people to wear, and we think that by the time the fall semester starts, many people will be very familiar with that as being part of their protocol for indoor use. With that, I think I can hand over to Cecilia, yes?
Nancy, is it possible to get the monitors up? It's hard to hear.
Sure. Guys, can we turn up the monitors here? We're on it.
Thank you, Nancy.
Sure. Go ahead, Dr. Rosales.
Very good. Well, good morning. I want to first acknowledge concerns and express understanding of how those affected by COVID-19 are probably feeling, and express my deep and sincere condolences to the families that have lost loved ones to this pandemic. I'm co-leading the testing team with Dr. Michael Hammer, a research scientist at the University of Arizona, as well as Melissa Colchado, who's a chief of staff for management and policy in the Office of the Senior Vice President of the Health Sciences. She's also the lead for the statewide antibody testing in collaboration with the state of Arizona. We're proposing to the leadership a Test All, Test Smart program as part of the Reentry plan. And the purpose of this plan explores the possibility of bringing students back to campus in a manner that is safe, protecting both the campus community and the community at large in Pima, Maricopa, and Cochise County, as we have campuses in Sierra Vista, Phoenix, and Tucson, of course. Its basic premise is that through utilization of currently available testing technology in combination with the full arsenal of public health tools, we are in a position to achieve this goal. To the extent that putting this strategy to work can protect the vulnerable, safeguard our healthcare system, minimize outbreaks, and mitigate the spread of the virus, it will serve the cause of keeping the University of Arizona as an active learning center with the prospects for extending knowledge of the coronavirus from the perspectives of both the sciences and the humanities. This proposed plan to test the University of Arizona campuses for coronavirus is necessarily guided by policy, and policy is in turn dependent on testing. This is true because of the feasibility of testing. The entire campus population is constrained by cost of testing and the personnel needed to administer testing. Therefore, this plan involves a mixed strategy, both in the type of testing as well as in the frequency that different subsets of the campus population are tested. This plan is based on the assumptions that coronavirus will exist in the population at large for many months to come until we have a vaccine, and that there is a group benefit for young and healthy individuals to acquire antibodies to the virus to begin the process of herd immunity. The success of this plan is also dependent on the active engagement and continued participation of students over the course of the school year, and therefore includes suggestions for increasing engagement, such as student testing networks. Those are student ambassadors that most colleges have on campus, course credit, many campus trials. We also commit to developing a clear communication strategy and plan to maintain communications with key stakeholders, both internally and externally at the University of Arizona. Thank you.
Okay, thank you, Dr. Rosales. Kacey Ernst.
Hi. Thanks very much for having me today. I want to preface my statements by acknowledging, as Dr. Rosales did, the individuals who are currently suffering from the COVID-19 disease, as well as those who have lost family members or friends. I think it's really important to acknowledge that people are going to come into this and potentially come onto our campus in varying degrees of both physical health as well as mental health. So it's really important to acknowledge the need to provide a holistic support system for everyone on campus. I would also like to state that many of the activities that I've been involved in, I am not the lead on. These are requiring a large number of teams. People from many different disciplines are working on different aspects of these planning efforts. And as Dr. Robbins stated, a lot of these are still in the works. We're still trying to evaluate and determine what is going to be the most effective, meaningful strategy forward that's going to reduce risk as much as possible. So a couple of the different strategies that I'd like to talk about today. One is a Wildcat Wellness Check. And this is something that I've been working on with David Zalewski from Campus Health, as well as Narav Merchant and Steve Rains and others. And what we're trying to do is to develop a text-based platform that allows people to check in with us on a daily basis, to tell us if they're healthy, to tell us if they are feeling ill, and if they are feeling ill, to be able to direct them immediately to resources such as the testing in order to determine if they are infected or if they are suffering from something else. This is still sort of at the very sort of initial stages, but what we're hoping that this will do is to provide a sort of pulse of what's happening on campus. Without knowledge, without knowing what's actually happening on campus, we can't react as quickly or as nimbly as we would like. So this is going to both identify people who may be ill in the population on campus, but also to try and reach out to understand other aspects of well-being that may be compromised as we move forward. So people may have challenges accessing masks, they may have challenges conducting physical distancing, and so being able to identify subpopulations that may be experiencing these challenges will allow us to reach out and to mitigate those challenges through different strategies, perhaps providing additional masking, providing hand washing or other stations, or crafting additional messages that may be targeting subpopulations that may be having more difficulties adhering or being able to take on these additional prevention practices. I think one of the really important aspects of work is related to this component of human behavior. And our social and cultural norms on campus cannot be overemphasized. We really do need to understand people's perspective as we start moving forward with our planning efforts. So I'm also part of a group that's led by Diane Austin that's been thinking about how to assess people's understanding and response to the pandemic and their opinions about how to approach coming back to campus. This work is just being developed, but is very critical to understanding the perspective of faculty, staff, and students before and after arrival on campus. So we don't want to just know what's going to happen before they arrive, but we want to continue to check in with people to understand. So people's understanding of the pandemic, their personal risks, its transmission, and the effective strategies to reduce transmission are essential determinants of how they will approach their own personal decision to return to campus and how well they will be able to adhere to the guidelines and policies for reopening. And then the last project I want to talk about is the validation of the Bluetooth contact tracing application. So Dr. Schroeder, who is also here, coordinates the contact tracing group on campus, and I'm sure she will speak to that a little bit more. But as one of the pillars of the plan, contact tracing must be comprehensive and timely. Contact tracing is critical to identify individuals who are exposed to someone with a confirmed coronavirus infection. It's particularly important in a campus setting where individuals are in close social networks that could facilitate rapid transmission. With appropriate contact tracing and notification, exposed individuals can maintain distance from others until the 14-day window has passed. This reduces the chance of transmission to others. Multiple strategies for contact tracing on campus are planned. Manual contact tracing is being led by my colleague in public health, Dr. Kristen Pogreba-Brown, who's working closely with the Pima County Health Department. We're also in process of testing 2 additional strategies, one of which is the use of a Bluetooth application built by COVID Watch. This mobile app would anonymously exchange codes with other cell phones through Bluetooth. The signal strength and duration are recorded. Then, when someone has a confirmed positive case of COVID-19, they and their provider receive codes that they can enter into the application. Then a notification is immediately sent to all the phones that they were in close proximity to each other. This completely anonymous way of contact tracing would be very beneficial in high-density areas like a campus where you may even be within close distance of someone for a substantial amount of time but not know their names. My role is going to be to lead experiments that will test the accuracy, usability, and acceptability of this application over the summer. From simple tests like placing phones of different types at different distances to mock runs within operational systems such as the campus health, we plan to put the technology through its paces to make sure it operates in the way that we hope it will. So each one of these projects reflects what I think is a great strength of the University of Arizona, which is the ability for multidisciplinary teams to come together, to collaborate, and to address complex issues. I think that's one of the University of Arizona's hallmarks, is our ability to carry out these kinds of interdisciplinary projects. So thank you.
Hi everybody, my name is Kate Ellingson. I'm an infectious disease epidemiologist and study infection transmission and prevention in healthcare settings. One of my contributions to this group is to think about how we can harness the lessons learned in healthcare in terms of distancing, hygiene, self-monitoring, culture change, and testing in this environment, acknowledging that the campus environment has different levels of risk, but there are many lessons learned from this setting where they've never had the opportunity to close down in healthcare. My role in this effort is really as a member of the core planning team, which was charged with initially articulating the guiding principles and strategic domains for maximizing safety during a phased reentry of students and staff to campus. So you've heard about some of the strategies already, and you'll hear more over the coming weeks. One thing I'd like to highlight here is a key premise of our overall reentry plan, and that's our commitment to coordinate closely with public health officials as we make decisions about when and how to reopen. This includes open communication channels with the Arizona Department of Health, as well as the local health departments in the multiple counties in which our campuses are located. It means that we continually assess trends in case counts, local healthcare capacity, and our joint capabilities for robust testing and contact tracing. Minimizing COVID-19 transmission on our campus also protects our surrounding communities, including the vulnerable populations that our public health partners worked so hard to protect. In collaboration with our public health partners, we'll keep a close eye on healthcare capacity at our local hospitals, including bed capacity, adequate staffing, adequate access to personal protective equipment for healthcare personnel. These factors ensure that our healthcare providers can safely provide care to our university and staff, our university students and staff if needed, while also meeting the needs of the broader communities. To this end, I, along with other epidemiologists and public health experts in the College of Public Health, am keeping a close eye on our local, state, and national trends with regard to COVID-19 transmission. This includes week-to-week changes in the number of new cases, indicators of healthcare capacity, as well as changes in our ability to respond to new cases with testing and contact tracing. These metrics, which align with what CDC has defined as the gating criteria for re-engaging in public life across the nation, must be assessed and reassessed and evaluated in combination as we plan for our campus reentry. And we'll continue to do this after the campus reopens. A recent assessment of Arizona case reporting showed a 14-day rolling decline in the number of reported cases, which is good news. But we must monitor this as the impact of the recently expired stay-at-home orders is not yet detectable through these calculations. That said, in the past month, the state has tripled its COVID-19 testing capacities, and we continue to increase our capacity on campus to make and distribute kits. Should we see any concerning trends with increasing case counts, outbreaks fomented by super spreading events in the community, inadequate capacity for testing or tracing, or a healthcare system that is stretched beyond capacity, we'll invoke contingency plans. Nonetheless, at the University of Arizona, as several have mentioned on this stage, we are moving forward with evidence-based plans to reopen our doors to students and staff who choose to return once we make that decision in collaboration with our public health partners. So I'd like to just briefly run through the guiding principles of the overall core plan that's guiding this effort. The first is equitable outcomes for all staff and students, regardless of their decision to return to campus. We know some people are at increased risk and may make the choice to stay home and to engage in campus activities remotely. And it's important to us that they are not discriminated against and that they have equitable outcomes. The second is rapid identification and containment of COVID-19 cases, acknowledging that there will be transmission in our community when students and staff return. On-campus and off-campus isolation options and wraparound support services for students and staff who may become ill with COVID-19. Protection of individuals in our University of Arizona community and family members who might be vulnerable to the severe outcomes of disease, acknowledging that many of the students will be at low risk, but that there are members of our community at high risk who will be affected by the mixing of low-risk individuals. Also, a commitment to transparent and participatory decision-making. We're seeking input from our campus community as we're building these plans. We want to assess the acceptability of our proposed interventions, as well as people's willingness to engage in what we're asking them to do in terms of mask wearing and social distancing, et cetera. And finally, vigilance in our sort of regular review and updating of our approaches to make sure that it's aligned with what we know about the evidence base for preventing transmission. So these are our guiding principles, and then the key strategic domains. 1 through 3 are test, trace, and treat. The 4th is to offer flexible participation, which I've alluded to, having an online option for students or faculty who can't come to campus. Minimizing contact and reducing crowding, so you'll be hearing about how we're going to try to do this and maximize physical distancing. Minimizing transmission when physical distancing is not possible. So this is when we rely on lessons learned from PPE use and mask use. And finally, to just continually communicate with where we are in terms of the stages of the plan and to get reactions from our campus community. So, thank you.
You ready for me?
Thank you. You're up.
All right, thanks for giving me the opportunity to come today and tell you about what we're doing on campus and also to address a lot of questions that I've gotten from my friends here on campus, students, staff, and faculty. So I've been a faculty member here since 2002, and I know that there's a lot of people out there who are really concerned about what's going on and they want more information. So I've received a lot of questions, and I'm going to do my best to answer those this morning. To put it in context, a lot of people have been wondering, why can we come back when we had to leave in the spring? And I think one of the things that I've learned from my brilliant colleagues here in public health and the medical field, who are all a part of this process, is the way that humanity addresses infectious disease is through a well-established scientific method of being able to test for the disease, finding someone with the disease, tracing who they've been in contact with, and isolating those groups of people away from the general public. This works. You can see decades worth of data demonstrating how well this works. In the spring, we didn't have the capacity to do this the way that we needed to, so we all had to isolate. But we have so much greater capacity to test now, to trace now, and over the summer, we're building up our capacity to trace to really historic levels, and that's where the team that I am leading comes into play. So I am co-leading a contact tracing team with one of my colleagues from public health, Kristen Pogreba-Brown. She is leading the component of manual contact tracing, and this is what people think of when they think of contact tracing, where someone calls you up, you have a positive test, they find out who you've been talking to, who you've been associating with, and they help put those people in isolation so that you're no longer coming into contact with the rest of the people in your community. What we're doing to add to this is to build a contact tracing app. And this is brand new and it's really exciting, but it's also worrying a lot of people. So I'm going to give you a really, really brief overview of what it is and what it isn't. So what it is an app that adds on to your phone that you have to add yourself. Nobody's going to make you add it. You have to activate it. Nobody's going to make you activate it. And if you get a positive test, you have to put that in. Nobody's going to do that to you. Okay, so the first thing that I wanted to make clear is each individual has total control over the use of this. The second thing that I need to make clear is that it has zero personal data. So the really cool thing that these wonderfully brilliant people can do is they can get your cell phone to use Bluetooth to talk to each other in a completely anonymous way. So they basically, one person's phone will send out gibberish, another person's phone will send out gibberish, and they'll listen to each other. The phones will listen to each other. They won't say who you are, they won't say where you were, they won't say who you're talking to, but they'll maintain that information. And then if somebody gets a positive test, they put that into their phone, and then other phones can say, hey, was I talking to that person with that phone who had a positive test? And if so, then they can choose to go test themselves and isolate themselves. The thing that I want to make clear is that your personal choice is absolutely inherent in all of this process, and no one knows anything about you. It's totally anonymous. It's just gibberish your phone is sending out. So we have really great people on this campus who are leading the development of the app for this campus. People such as Nirav Merchant, Joanna Mazel, Darcy Van Patten, Jeremy Frumpkin. These guys do this. This is their job. They are experts. They're worldwide experts. And they're working with another team called COVID Watch, who has been working on developing this app in a completely privacy-conserving, completely anonymous way to help us be able to utilize this. And the benefit of using this technology is it allows us to really scale up. So instead of a person calling a person, phones can contact as many phones as they were in contact with. And so it allows us to scale this up to a degree that we can bring 60,000 people back on campus and find out, were you in proximity with a person who tested positive, in a way that allows you to isolate and keep our campus more safe. So I wanted to give you guys an opportunity to sort of hear the basics of how this works and the privacy and the fact that it's up to you. Nobody's going to force you to use this, but we're going to hope that everybody uses it, because the more people on our campus who use this technology, the safer we're all going to be. So we really have to approach this in the perspective that we're all a part of this big community. In fact, we have people from ASU and NAU who are joining our team so that we can really think about this as the fact that we're all living together, and the more we can all help each other by keeping track of these sorts of things, the easier it'll be for us to get back to a normal life, an engaged life, and get back onto the campus that we love.
Thank you, panelists, and we appreciate your time, but more than that, we really value your expertise. We're going to open this up now to the media to ask any questions you'd like. One of the things that the University of Arizona is committed to is not just transparency, but also being access, your accessibility to us, to our experts. So please don't hesitate to contact us if you have a story or a question. The microphone is right back there, and Pam Scott will direct things back there. As you have questions, come up one at a time. Please wear your mask and please stay 6 feet apart. And also address your question to a particular person if you need to.
I don't know who might be able to answer my question, maybe Kate. We've seen a lot of pictures and videos of students and young people going out to bars or going out to restaurants and definitely not practicing that social distancing. How much do you think really implementing these kind of policies and procedures on campus will help when, half of students' lives are outside and off of campus, as well as their social activities?
We acknowledge that one of the reasons that students want to get back to campus is to re-engage in social life that is so important at this age. And one of the things that this task force has done is to engage our colleagues in the social and behavioral sciences. So we, even as recently as yesterday, were on a call talking about how we actually message to students, how we frame these policies and recommendations, how we sort of entice them to join in and to protect each other in their larger communities. And so to this end, we have experts in our Eller College of Business who look at marketing to this age group, and they've been talking about how to, when they're giving orientation and education about binge drinking, incorporating messaging about social distancing and protecting each other. We have experts in the field of psychology who are also, trying to figure out how we develop training for all incoming students that would really ensure that they understand the seriousness of the implications of transmission, even if they are considered a low-risk group.
I'm
Jay Gonzalez.
This Tucson Magazine. I guess this is probably for Dr. Robbins. Is there a timeline or a time frame that you have to make a decision for students to be able to plan to come to campus? And following up on that, is there sort of a standard you're trying to reach or a goal you're trying to reach before you say, okay, this is good enough to let the students come to campus?
Yeah, really good question. I'm probably going to ask Provost folks to help me out on this, but we've been watching, and as she said, it's 89 days until August 24th when we plan to have everyone come back to campus. It's going to look a lot different, obviously. I'm assuming that we're going to give everybody that comes to campus a couple of masks. It won't be the usual welcome back Arizona swag. It'll be masks, it'll be hand sanitizers, hopefully a thermometer. And I think that Kate and all the incredible experts here who are doing the work that will culminate in a recommendation of a go, no-go date. And I don't know, Liesl and Rich can comment on what they think, but we have to be reasonable to the students and to their parents and to our alumni to give them a reasonable time frame. I'm thinking it's probably 1 to 2 months out from August 24th, but I'll defer to them and let them answer that. I get calls personally about, I need to know whether to reserve a dorm room. I need to know whether to rent an apartment. Are the classes going to be in person? Will it be a hybrid? Will some of the classes be online and some be in person? So maybe Liesl and
Sure.
then Rich could address
I agree with President Robbins. I think we need to give people at least a month of notice if we're not going to welcome them back to campus. But for now, we're planning ahead with that optimistic forecast. So, you know, we will make sure that we don't, absent some very rapid change in circumstances, we will of course want to make sure that if we're not going to come back to campus and not going to welcome people back to the dorms, that we give people at least a month of notice. But I am constantly reminded that we are a large campus. We're like a small city, but we are embedded in a wonderful county, in a wonderful city, in a wonderful state, and we absolutely, all of our decisions have to be informed by what's going on around us, as well as what we can control and what we can modify to maximize protections on our own campus. So we're not operating in isolation, and the decision needs to be made in concert with all of our state and local authorities. Dr. Carmona, do you want to add something there?
Sure. Well, certainly I agree with the Provost and with Dr. Robbins. I think the beauty of the system that we set up is, and especially with all of the specialists that are here on our team, is on a day-by-day basis to be looking at what the trends are. You know, it's a snapshot every day from the epidemiologist of how much disease we have in the community. And the trend line over time, is it going up, is it going down? Are people adhering to the social distancing? Are they wearing masks? These are all the variables we look at on a daily basis so that each and every day this information is accumulated. We're able then to, at the same time, be preparing the university to open, because that's the physical structure. But whether or not people are going to come in or not, or how they're going to come in, is being answered every day. And as the president gets to look at the information the team provides him as to the trend line, have we maximally mitigated the risk to our students, our faculty, the community? And as the provost said, it's our little city of UA, as part of a bigger city of Tucson, as part of the county, and as part of the nation, because our students come from all over. In fact, 15% come from international locations. So we keep an eye on what's happening internationally as well. All that information comes together so we can give the president the best information in order to make an informed decision that's in the best interest of our students, faculty, and the families that care about them.
Thank you, Dr. Carmona. We have another question. Please identify yourself.
Brian Brennan, KGUN 9. The question ultimately for the president. But of course, there's already been some talk already of gating criteria, how we're going to be using the data. There's concerns about a second wave in the fall with cold and flu season. I wanted to kind of follow up on what you were already talking about. What is the threshold that the data would show with hospitalizations, mortality rates, case counts? when you would decide to not open the campus?
Yeah, I don't think we have the final answer to that yet, but it's an important question, as was 2 questions ago. My big concern is Provost folks and the people on campus for students that are living in our residence halls will have some regimented way of social distancing and educating and having rules, guidelines, and procedures. My concern is those individuals that live off campus and come back and forth, and I've been down to University Avenue, as I know Provost Folks has, and we aren't seeing the social distancing that we need and the face covering that we need. So as many people said, and I really love Dr. Rosales' idea of we will never ever be successful at this unless we mobilize, engage, and have our students be the ambassadors for the message to set the norms for their peers. And it's an incredible learning opportunity for them, not only to learn about the basic science of what contact tracing is and what testing is and how this virus works and the basic science of how this works and pandemics in general, because this is not going to be the last one we see. Right. So I think it's all good questions. To answer your question about when would we see, I think, I'll depend on all these experts. I don't have the answer for that. I kind of look and say, I think at the peak we were probably utilizing about 25 to 30% of our ICU beds in the greater Tucson area. And as long as the hospitals can handle the sick, then I think we're in a good position. But if we obviously got to where New York City was, we would just have to say that's a bridge too far. But you're starting to see, this whole group is going to be paying very close attention to places like Montgomery, Alabama, which their ICU beds are full. They've got patients just like New York City on ventilators in the emergency room. We would not, I'm going to go out on a limb here and get out in front of the group, but I think if we see our hospitals jam-packed with patients on ventilators and a big peak, then we would decide not to go. I'm not even sure, and the experts here can correct me or make more intelligent comments, I'm not even sure we've seen the first wave in Arizona. And I will say that we speak constantly, as I said before, with our colleagues, and I'm really impressed. There was a New York Times journalist who was embedded in the University of Kentucky working group like we have, and it's a really good read about their president is a world-renowned public health expert. Their dean of public health at University of Kentucky is a former president of the American Heart Association, so she is really good, and I really enjoyed reading and talking to them about their approach. The president of the University of Miami, I think, made some really good points the other day and actually used the reference to 3T in his first pillar of how they're going to deal with bringing individuals back to University of Miami. He's the former dean of the College of Public Health at Harvard. He's the former minister of health for the entire country of Mexico. Yeah. So we're learning from each other and sharing best practices. But I tell you, I would put our team up against anybody in that we were on this early and we're meticulously, thoughtfully planning going forward. I will say the final thing about the president of the University of Miami, his fourth pillar was immunization. And as we all hope for a vaccine for COVID-19, getting your flu shot is going to be really important because the inevitable second wave is going to be mixed right in traditional influenza season. And the old thing, is it live or is it Minirex? Is it influenza B or is it COVID-19? Makes a really big difference because COVID-19, unlike regular influenza, which is bad, and we should follow all the public health good hygiene practices of washing your hands and distance yourself and of course covering your face. But we need to determine which it would be, because if it's COVID-19, we have to have aggressive isolation and quarantine.
Thank you, Doctor. We have time for just one more question. We are live, so we have kind of a clock we have to follow. Do we have one more question from the media?
So Sam Burdett, Daily Wildcat. Housing applications have been open for a while now, even before the pandemic. So my question is, will people in this lower capacity of housing, will people be asked not to come back? And if so, how will you decide who gets to come back to the dorms?
I think that's Liesl's question.
I'll take that one happily. Right now, we're in the happy position that we can adjust the density of students in our dorms and actually meet all of the current demand. And so that's a reflection of the fact that people, of course, are not signing up for dormitories in quite the numbers that they have historically. That allows us to reduce the occupancy levels and still meet all of our demand, we hope. Now, that's the current plan. I can't guarantee you that it'll be a plan on day one of the semester, because again, if the conditions change dramatically, we'll have to adjust. But right now, we look like being able to meet all of the current demand, which makes us really happy, because actually, President Robbins went out on a limb one day and said that he's wondered whether we might not be able to have people in the dorms at all, or you know, that they'd be reduced in occupancy. And immediately our phone lines were flooded with parents and students who were very concerned about not being able to have the dormitory experience as part of their campus life. And so we want to be really clear that we are very much working towards a safer operating modality in all of our dorms so that our students can have that rich campus experience if at all possible. So we're planning forward. As Dr. Carmona will say again and again, we have to have our plan B in our back pocket in case plan A doesn't pan out. But that's our plan right now, is to be able to reduce occupancy but still meet the demand among our students and their families to have that dormitory experience. And it's so, we know it can be so formative, especially for our incoming Wildcats, our new first-year students, to have that dormitory on-campus experience, and we're working hard to see if we can make that happen for them.
Thank you, Dr. Folks. Now, some of you may be wondering why we're not wearing masks right now when we're all 6 feet apart. And believe me, we wear masks all the time on campus. It's kind of hard to talk to you with the masks on. That will wrap things up here. Dr. Robbins, do you have any closing thoughts that you'd like to make?
Well, we didn't have time to get to everyone's questions, but we'll all be available to answer any other questions. I would just say tune in next week because we'll continue to update you. 168 hours is a long time for us to work, and I'm telling you, people are working so hard on trying to get a plan together of how to not only just survive, but also to thrive at the University of Arizona. And I'm confident after you've all heard, you'll join me in thanking everyone who's here for all the work they're doing. Every week we'll have different experts come back and update things. I see Chris Kopek here, who's going to be key because he makes this whole campus run. He'll be with Dr. Carmona looking at airflow and looking at Liesl didn't mention the water-based, wastewater based epidemiology, but he's the person who knows where all the pipes are and where all the infrastructure is, which is going to be really, really important as we look toward the future of how we reopen. But I'm really confident, as I said, this is an incredible team, and there are hundreds and hundreds more that we'll bring back over the next few weeks and update everyone with statistics and what we're thinking, and sort of nail down those policies about which tests will we do, how many people will we test. We are offering the antibody test to every faculty, staff, and student who chooses to take it. So we're going to make good on our pledge of offering a test to everyone. But I think the details that, and Dr. Rosales could tell you 100 times more about this than me, about how we, the ideal would be we test everybody every day. It's just not possible in terms of doing the test and being able to afford those tests. I'm really confident that we'll move towards maybe an antigen screening test. So there's the antibody test, there's the viral or molecular test that looks for active infection, and that's what we'll be doing a lot of tests. But I love the way she put it: test all, test smart. And so using all of these modalities of looking for hot spots, certainly every symptomatic person will be tested. And then do contact tracing to find out who, if they're positive, who they've been in contact with. So I look forward to seeing you again next week, and another 168 hours of incredible amount of work to try to get to an answer.
And we want to thank the media. We want to thank you folks at home. Next week, hopefully, same time, same place, more experts. Thank you.
Well done, team.